Have you been told that you have a pelvic organ prolapse and that your organs are going to fall out of your body? What a terrifying thing to hear. Believing that things are falling can actually cause you to hold everything in, which can increase intra-abdominal pressure, potentially making your symptoms worse. Today, we're going to explore what prolapse really is and what steps you can take to reduce or eliminate your symptoms. A pelvic organ prolapse is a hernia found within the pelvis. But what is a hernia? Well, a hernia is a point of weakness in the tissues which becomes the path of least resistance when there's an increase in pressure. Most people have herniated tissues somewhere in the body. Now, this can be as small as a varicose vein or as large as a full diastasis recti, where there is separation between the six-pack muscles on the abdomen. To demonstrate herniation, we're going to use a balloon. Normally, functioning tissues will expand when pressure is increased, just like the balloon. We can create a point of weakness in the balloon by adding excess tension, so in the form of some duct tape. Now, when pressure is increased, it causes a bulge due to the tissues not being able to uniformly expand. This is the same as a hernia. If you have given birth and you have scar tissue from a vaginal tear, this would introduce some restriction where the scar tissue forms. The scar tissue won't expand when it comes under excess intra-abdominal pressure, which can cause nearby tissues to unevenly expand. And it's that lack of extra expansion that creates this point of weakness where the herniation can occur. The symptoms of prolapse are generally felt when there's an expansion from increased intra-abdominal pressure. The first step in eliminating the prolapse symptoms is to release excess tension. So this can be done through myofascial release techniques or through pelvic floor relaxation exercises. The second step is to learn to manage intra-abdominal pressure, which involves a few steps. Firstly, you need to ensure that your pelvic floor can contract and relax in a very balanced way. Pelvic floor hypertonicity, where there are overly tight muscles, or pelvic floor hypotonicity, where there are overly lengthened muscles, will reduce your ability to manage intra-abdominal pressure. Your pelvic floor muscles need to be able to have balanced tension along with your core in order to manage intra-abdominal pressure. Breathing plays an important role in the balance of tension within the body. Therefore, it's also important to learn how to breathe efficiently in order to limit unnecessary downward pressure. When you rebalance the tension and learn to manage intra-abdominal pressure, it empowers you to live an active life without being limited by your prolapse.